Hi, everyone. Pete Schooner with Ohio Today Magazine, back with another Bobcat Chat. Today, Dr. Scott Yoho, who's the owner and medical director of Emerald Psychiatry and TMS Center in Dublin, Ohio, joins us. Um, Scott is a multiple-time Bobcat. He has degrees in finance and psychology from Ohio, as well as his medical degree from the Heritage College of Osteopathic Medicine. Dr. Yoho, thank you so much for joining us today. I kind of just want to kick off, if you don't mind, by checking in with you. Just how are you doing? How have you been doing over the last several weeks?
Yeah, great. Thanks, Pete. It's great to talk to you, and it's always fun to reconnect with OU in Athens whenever I can. So things are going well. I know it's a tough time in the world, but we're helping people as best we can, and adapting like everybody is. I'm fortunate that we've made some really great friends in the Athens areas of the year, so we get to come back 2-3 times and visit. So I still feel very connected to OU in Athens. So happy to talk to you.
Great. Well, I'm happy to have you. Throughout this video series we've been doing, we've heard a lot from Ohio experts and alumni about staying physically well, whether that's specifically related to COVID-19 or sort of just generally as we're all coping with being at home, staying at home, and the physical distancing restrictions. But we really haven't talked a lot about staying mentally well. And so I wanted to, have you on to kind of explore that topic. What aspects of mental health and maintaining it during these times should people be aware of? Especially maybe things that aren't so obvious.
Yeah, it's a great question. And I think one of the things that's been kind of neat watching how this has all progressed is that people really are giving more attention to the mental health side of it as well. I mean, there's obviously the physical part of it. That's first and foremost. But I like the way you said it, physical distancing. At the beginning, people were calling it social distancing. I think that really made it hard for people to wrap their head around it. That we're lucky in one regard that we're in an era where we can reach out like we're doing right now technologically and be closer to people. So, it's just a time of an enormous amount of uncertainty, which, dealing, with those types of issues before was a real thing. When we think about, control, being able to control what's happening around us, uncertainty, unpredictability. I don't think, at least in my lifetime, we've had a period of time like this where there is so much, and not just for patients who have, a previous mental health condition like depression or anxiety, but for patients who, or for people who really never had those issues before, whether we're talking about, is school going to start, issues with work and jobs and finances. So, we think about things like positive coping skills. You said, coping at home. So we want to make sure that people are just aware of what's going on inside them. There's been a lot of recent data about how much more people are experiencing depression, anxiety. There was just an article in Time the other day about those types of issues. So the biggest thing in my mind is if it's kind of bleeding into an area of dysfunction, where it's causing them problems in their life, as far as isolating or feeling more depressed or hopeless, that's when you got to reach out. And just knowing that there are people out there that want to help you and can kind of relate to those things and make good recommendations, even in the era of physical distancing.
Sure. So what, I guess, specific advice might you have for those who might be feeling those new or maybe just sort of intensified feelings of anxiety or depression? Do you have any kind of positive coping tips to suggest, and then maybe what should people look for if they do need to then reach out for more help?
Yeah, absolutely. So when we talk about positive coping skills, we think about ways that we're going to deal with stress or anxiety in a positive way, as opposed to a way that could be potentially negative for you or making things more negative. So we've seen, a lot of people increasing their alcohol use, increasing substance use, isolating, becoming more dormant, not paying attention to things that we know promote mental health, like diet and exercise. Um, so, if you feel like you're kind of falling into that pattern, and again, it starts causing problems in your life, whether you just are feeling more depressed, you're not reaching out socially. My first recommendation is you have to reach out. You got to talk to somebody, a friend, a family member, a professional. If the things that we're not doing on our own, if those things aren't working and kind of getting us where we need to be from a mental health standpoint, we got to reach out and do something different. Okay. So in general, anything good for your heart is good for your brain. So people know what kind of things are good for your heart. We think about, a nice balanced diet without too many calories, minimizing alcohol use, and then exercise. I mean, obviously, you have to be aware of what your physician will let you do exercise wise, but generally, unless you've been restricted, you want to get your heart rate pumping to a point where you can't comfortably talk on the phone. Okay. So anything's better than nothing, but walking out to get the mail is not really where we want you to be. We want you huffing and puffing and I'm gonna have to call you back. That's where we really get your blood pumping, and people can kind of see some results from those types of things. There's all kind of ways you can do it, and I encourage people to get creative. And if they do have more free time at this point, learning some new technologies, being able to reach out socially through Google Hangouts or whatever platform you use. It's not the same. Everybody knows that, but in some ways, it's some of the differences are even positives. Um, when we think about just general positive coping skills, meditation, yoga, focus sensation work. There's a lot of good stuff on YouTube if you for free that you can kind of do on your own that'll help be a positive in your life as opposed to potential negative.
Great, thank you so much for that. I know regarding just the sort of connecting through technology, I've been seeing a lot of folks, a lot of family members in my life, more these days than in the past year or so. I've really enjoyed that part of it and found a lot of value in it. And I hope it's sort of one of those things that might continue even if we are, a little bit more free to connect with one another physically. Many of us are concerned about obviously maintaining our own mental health, but also wondering at the same time about our children. I have a toddler here at home. I'm sure many people watching have children of all ages. So we were concerned about how this experience might be impacting them too. So do you have any advice for ways to talk to those younger children about what's going on, or ways to best support, those teenagers who lost that connection at school and that interaction with friends?
Yeah, it's an important and really great question. It's multifaceted in that we kind of put our kids in our own mental construct. So I know I've got a 16-year-old and a 14-year-old, and so I really worry about them, and the physical distancing, kind of leading into less social interactions. What's going to happen at school. So when I think about it, I think, man, my kids must really be lonely and sad and bored. And what I'm coming to find is that despite all my best efforts in their younger years, fighting the technology battle, putting a number of electronics minutes on them, it was a losing battle from jump anyway. And that's just not the way the world is going, regardless of what happened with COVID. So they are used to screens way more than my generation is or was. So the social interactions they're getting now are actually, it's not as good as being able to go see your friends in person, some of the time, but they're very used to video chatting, FaceTiming, those kind of things. So I think from that aspect, it's not quite as affecting, but over time, it certainly will be. And when you think about things like, graduations and, how our school is going to graduate, transition these graduations, that is a loss. That is a rite of passage. That is a celebration of all their accomplishments that is going to get altered. So really, the biggest thing I think you can do is kind of what you said. When you talk to them, what can you do? Well, that's the first step. They need to know that you're thinking about them, checking in on them, even if they're teenagers and I don't want to talk about that, Dad. They need to know that you're thinking about them and that you care about them. And if you have any red flags, if they're isolating, if there's major changes in their activities, for kids, mental health symptoms can be different than adults. An adult can tell you, I'm sad, I've been crying a lot, I feel hopeless. That's easier for an adult to say. Still not easy all the time, but for a kid, it can come out in irritability, acting out. Those types of things can be more subtle signs that they're mentally not feeling as good. So one of the things I think is a good thing to do is to really give them credit for what they're doing to keep themselves, their family, our society safe, and just really praise them for their altruism. That for them making a sacrifice for the greater good and ultimately to keep themselves, safe and healthy. That's a tough thing to do, especially when you've had plans and they get changed or canceled. I'm kind of the mindset that we need to still be making plans for the future. That gives people hope. It's always nice to have something on the horizon that you're going to do when it becomes available. Our lives have not been canceled. We don't know how this thing is going to go, but at some point we should be able to resume at least some more activities. So that's the way I look at it. For younger kids, you just try to tell them the truth, tell them what's going on, but make it as simple as we can for them.
Great, thank you so much.
Mm-hmm.
On the topic of some of the technology and leaning more into that these days, I imagine your practice has had to do some of that as well. So how has your practice adjusted to kind of continue to deliver care during the pandemic?
Yeah, so telepsychiatry has been a passion of mine since I did my residency program. So at the end of your residency program, you do something called a grand rounds presentation, which is kind of like your thesis or whatever, your end project. And I did it on telepsychiatry because, in my opinion, there's really not a field better served and prepared to do telemedicine than telepsychiatry, because oftentimes, we don't need to touch our patients. In some boundary situations, we shouldn't touch our patients. So we can get a lot of the information that we need, practically all of it, from a distance, which is nice because it opens up the ability to treat more people that maybe don't have access to a psychiatrist or even a medical provider in remote areas. Having said all that, we did not have a telepsychiatry practice when COVID hit. Previously, insurance companies and even companies or even organizations like Medicare and Medicaid, they made it rather difficult for us to do it. But as everybody saw, they said, we can't have boundaries to what these people need as far as their medical care. We don't want them just flooding into the emergency department. So they basically said, hey, look, if they need care, we got to get it to them, and we're going to do that through telepsychiatry. So there was a period when everything kind of started coming to the forefront, where we had to quickly transition to get our providers out of our office and home and be able to provide a way for the patients to be seen. So we use a telemedicine program called Doxy.me. We can text or email a patient, and all they have to do is click on the text. They don't need any special equipment, and it comes up on their phone or their computer. And so we can see people anywhere at home. We're seeing a lot of people in cars because maybe some of the things that are stressing them out are in that home, and they don't want to be talking about that right next to the person that's stressing them out. So they go out to the car and we talk to them there. So we tried to move as many people out of the office as we can. So really the only patients we're seeing at this point in the office are TMS patients, which is a treatment for depression that hasn't responded to multiple antidepressants. So that's a treatment. It stands for transcranial magnetic stimulation. So basically we're stimulating an area of the brain that has been underactive, and trying to get it more active and get the chemicals where we want it to be to help modulate the mood. That's a service we have to do in the office. And so we're just doing everything we can to make sure that those patients are safe, screening every patient that comes in, taking a temperature, any symptoms. Everybody has, gloves and masks. We've moved the treater who provides the treatment out of the room, so there's less contact there. So it's a needed treatment for patients who are pretty depressed. So those are the only patients we have in the office, and everybody else is being seen remotely. And what we found is our compliance rate and our no-show rates are drastically lower. And I'm not going to say you don't lose some things with having the patient in the room, because it's nice to be able to kind of really feel out their body language and have that kind of physical connection. But I would say overwhelmingly it's been a positive experience both for the patients and for our providers.
That's great to hear. So as a Heritage College graduate, I'm wondering, how does that unique philosophy of osteopathic medicine enter into and inform your own work and your practice?
Yeah, well, I'm so proud of being an OU HCOM grad. I really don't feel like I could have gone to a better place. And I was talking to another provider yesterday about this, and she was telling me about the struggle she was having with her program. And I just remember, I didn't want to say this to her, but I remember thinking when I got into OU, it was like, you got taken into the family and everything was going to be okay at that point. As long as you work hard, do what you got to do, like we'll take care of if there's an issue. So I love that about Athens and the friends we've made in Athens and OU HCOM in particular. The osteopathic, education really just gives you a chance to look at things from multiple angles. I think you can get a great education, obviously, at an MD school too. But when you look at things from just a systems-based model, where you're just looking at, cardiology or pulmonology, and you're not really thinking about how everything, plays a role in this, especially, the behavioral, emotional, spiritual side of it. I think the training that we got at OU HCOM just really prepared us to be able to look at things from a different angle. Know that treatment is not one size fits all. It needs to be customized, and really the same thing I mentioned earlier. Like if the things that we're trying are not working, we got to do something different, and keep trying different things. So I think just having an open mind, looking at it a little bit more holistically. I know that's kind of a buzzword, but just taking the time to actually think about what this patient is going through and how can we help them. Identifying patterns and triggers that aren't helpful and coming up with a new plan to help them. That's what OU HCOM did to prepare me for something like this.
That's great to hear. So going back to something you said earlier, about making plans. This is, our lives have not stopped. We want to make those plans and have something to look forward to. I love that. And it sounds, again, it's like right in line with what it seems like is a big part of your practice and philosophy there, which is focusing on hope. So I'm wondering, in this day and age, where are you finding hope, whether that be professionally or personally? Could you share some of those bright spots with us?
Yeah, sure. That's a great question. Yeah, we when we did a little bit of marketing a couple of years ago, we really wanted to kind of think about what we were doing and why we were doing it and what we can do to help people. And we came up with the slogan, "Make Hope Happen." So really, the patients are the thing that in our practice really provides a lot of hope, because they're putting their trust in us to make good medical decisions and therapeutic interactions for them. But they're the one that is doing the work. They make the choices that ultimately become their life. So to hear some of our patients and how resilient they are, even just reaching out for help. I need an appointment. I need to talk to a therapist. I may need to change my medications. That is not always easy, especially when you're feeling crummy. So anytime a person who's feeling, depressed or anxious and reached out for help, I always want to give them credit for that. So just hearing, some of their stories about the resiliency, being able to talk about what's going on with them. And really, I mean, there's a lot of negative stuff going on, but if you look around, just watching how, other people are helping people, you know, the lengths and the efforts they go to make sure that the people they love and care about, or even people they don't even know, are taken care of. To me, it just, I know it sounds a little corny, but it just kind of speaks to, you know, what people are like, what our life is about. And to me, it's about, you know, connecting with people, the experiences that we can have with them, and we're shifting. Resiliency is a word I use frequently. Being able to roll with the punches, being able to be happy, having a system that's going to allow you to address, you know, big stressors like this. That's what ultimately is going to be something that kind of gets us through this. But watching people help other people, that's really what's brought me hope during this time.
Absolutely. Thank you so much, Dr. Yoho. I really appreciate you taking time out of what I'm sure is a busy schedule here to share these ideas with us, these tips. And I just hope that you continue to do well and take care. Do you have any final words for the Bobcat community who might be watching?
Yeah, just I guess my final words would be hang in there. We don't know what's coming exactly, but hopefully we can all work through it. I know it's not going to be great for everybody. I read an article the other day about some things going on in Athens. So just, we're thinking about you from afar. If we see you on Court Street one of these weeks, stop by and say hi, because I always love talking to Bobcats.
Sounds good. Here's to that day where we can all be together again in Athens.
Thanks, Pete.
Thanks so much. Have a good one.
You too.